It's Wendy Bowen with Know Your Body Better. So what we're talking about today is going to be the neck area. And I'm going to use my spine model and show you a couple things with the neck. So we're looking at the introduction to the neck. We have 7 vertebrae in our neck area, same as a giraffe has. You're going to put a head on top of that, the head here, okay? And that weighs at least 10 to 12 pounds. So the spine is designed to have certain curves in it. So this first curve you see here is lordosis, that's the neck. The second one is a curve the other way, which is kyphosis. And then your curve in your lower back is a lordosis again. And then in the tailbone area, it's a kyphosis. So what's supposed to happen is the weight of our head and our body is supposed to come down through these big bones, the vertebrae, down through there. When we get out of alignment, what tends to happen is people will put the weight through these joints here, these Z joints, if you can see those, and the weight goes down through those. These bones, the spinous processes, and the transverse processes, which are out here, these big bones, are actually meant to hold the muscles and help with movement. They're not supposed to take the load and the weight of our body, especially these ones out here, or the zygapophyseal joints, which are the Z joints. So when we're looking at the neck, what's supposed to happen with it, when you turn your head one way, let's say I turn to the left here, this joint, which is angled like this, is supposed to slide down and back, and the other one on the other side slides up and forwards. When you turn the other way, they actually slide the other way. So those are the angles of the joints that we're supposed to have. Now in between the vertebrae, you see these discs here, and these discs act like cushioning as well. And these holes where the nerves come out, right here the yellow is the nerve, these holes are 50% of it's the nerve, and what happens when you get a pinched nerve is this hole may be taken up by some of the bone or by soft tissue or the disc bulge. So if you get a bulging disc which puts pressure from the disc area here to the back, can pinch the nerve, and that can send pain from your neck all the way down your arm into your hand, tingling and numbness as well, and muscle tightness. So that's part of the anatomy. We'll go over a little bit more with the vertebrae because you have the vertebral body here, and like I said, the spinous processes, the transverse processes, the Z joint, the intervertebral foramen, that's what the hole is called. So that's the anatomy of the spine.